Hi, I'm Tiffany Henry. I'm the nurse with the Breast Center at Phelps Health in Rolla, Missouri, and I'm going to give you a quick tour of our facility here. When you come in, you're going to come into the ground floor of the medical office building. You'll take the elevator to the first floor. We're on the first floor, right off the elevator to your left here. So back here, we're going to go into our dressing rooms. So when you come in, we're going to grab a gown for you. It's a pink cape. We have you undressed from just the waist up. These button in the front, and they're just kind of a short little cape there. So we're going to ask if you've worn any lotions, powders, or deodorants. We want to make sure that you don't have any of those on. So if you can, remember not to wear those to your appointment. If you do, it's not a big deal. We'll wipe it off, but it can show up as an abnormality on your test, so it can cause you to be recalled unnecessarily. I would recommend that you not wear a dress or a romper because you're going to only need to undress from the waist up. We'll ask you to have a seat in the waiting room, and then one of the technologists will come and get you. This is Julie. This is Julie, our wonderful mammographer.
Hi, I'm Julie McCrae. Like she said, I'm one of the ones that will be doing mammograms for everybody. I can take you in here and we'll show you the mammogram machine. We have 2 rooms here. This is one of ours. Routine screening mammogram. We typically do 4 views. It'll be a frontal and a side view of each breast. With the 3D mammograms that we offer, the exposure time will be about 40 seconds. We're going to have you just breathe normal for that whole exposure. Also in that time, this part is actually going to move. It does a sweep. That's just how it takes those additional views. It'll go towards the left and just kind of slowly sweep back across. You'll kind of feel it just a little bit on the cheek as it does that sweep. As far as compression, of course, everybody knows mammograms, we utilize compression. I'm not going to lie, it's going to be a little bit uncomfortable. Really shouldn't be painful though. Most of the technologists are going to go very slow and talk you through the whole process, and you just basically need to let them know if it is painful for you. But like I said, it should just be mostly uncomfortable. So we utilize compression. People sometimes ask, why do you have to squeeze them so hard? Basically what we're trying to do is we want to separate the tissue out. Some ladies' breasts can be very thick and be very dense breast tissue, and if we take a picture of that just all clumped together, it can be very hard for our radiologist to make any determination because it just looks like kind of the big clumps of breast tissue. So by separating that out, it kind of makes it a little bit easier to find any lumps or anything that might show up. That's the whole point of it. Sometimes when we bring you back in, we'll utilize and we'll do some spot compression views, and basically we'll put a much smaller paddle on. It'll be about this big, and it's going to just compress on that specific part of the breast, and that's the point of that, is to just get good compression there and kind of hopefully be able to separate that tissue out, and whatever the density or asymmetry that the radiologist is seeing, we'll be able to kind of separate that tissue out. So we do have 2 radiologists here on staff that take a look at these mammograms and give the reports. Once they read that, of course, the report will go over to your ordering physician. And then if you're signed up for the new patient portal called MyChart, the results letters that we've always mailed to you in the past will show up for you on there. That's usually within about 24 to 48 hours after the exam. If you do not use the MyChart, we will still mail you your results letter, and we usually say about 7 mailing days for that. And you will receive a results letter, good or bad. Either way, it's going to tell you that you're good to go for the next year, or if we would want you to come back for either additional views in here or an ultrasound, it will also go over with you in the letter. So we do offer the 3D mammograms. We are the only place here in Phelps County that offers it. Basically what the 3D mammograms does is it takes tomosynthesis, it's slices of the breast. So just depending on your size and thickness, it's going to take anywhere from 30 to 100 slices. So we still get our 2D images that we've always done, those 4 pictures, but then you'll get, say 50 slices for each breast. So instead of 4 pictures, you're going to give the radiologist 200 pictures. So definitely gives them a lot more images to go through. They can start at the top of the breast and kind of scroll through to the bottom. They're able to determine what's on the skin surface easier, and if there's truly something in the breast, or is it just a density or an artifact that's showing up. With having those additional slices, it makes it easier to make that determination for them. The 3D mammograms also have been proven to have about a 30 to 40% higher detection rate for cancer than the original 2D ones. So definitely a lot of advantages for having them. Starting in 2019, Missouri actually passed a state law that requires the insurance companies to cover the additional fee for the 3D. So we basically do them on everyone unless they request not to do the 3D. So that's a big advantage. We used to have to charge the patient extra for that, and it was an optional thing. So with the insurance covering it, definitely an advantage for the patient.